Good afternoon, and thank you for joining us today. Here is our latest update on COVID-19 for Pennsylvania. As of 12 a.m. this morning, we have 1,245 new cases of COVID-19. This brings our statewide total to 27,735 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Approximately 1,401 of our total cases are now in healthcare workers. Tragically, we have now had 707 deaths among those who have tested positive for COVID-19. And to date, all of the deaths have been in adult patients. As of noon today, hospitals are reporting that approximately 2,503 patients are currently hospitalized due to COVID-19. This is slightly less than 10% of our total case count. 664 of those patients that are hospitalized have required the use of a ventilator or a breathing machine. Across our health system now, approximately 41% of hospital beds, 37% of intensive care unit beds, and nearly 70% of our ventilators are still available. We have been working to provide you with more refined data on the information that we report on positive as well as negative cases and deaths. In addition to our positive case counts by county, we've now expanded our reporting to also include negative results at the county level. We've also created a table that looks at the regional picture. As you know, the highest concentration of cases has been in the southeast and the northeast of Pennsylvania, but every region has been impacted. We've also broken out our positive results and death information to include gender. As we talked about earlier this week, much of the data reported to us on race and ethnicity is not complete. And we are working with healthcare providers and laboratories to get more information about race and ethnicity. But we are now providing the data that we do have related to positive cases and deaths by race. It is important to remember that the data reported for one day is a snapshot of what happened the day before. We are looking at trends in data to base our decisions and to see if the social distancing, the mitigation and prevention measures that the governor has ordered are working. Our trends show that the Pennsylvanians' sacrifice to stay at home is working. We have been able to flatten that curve, and to date, our healthcare system is staying stable, and we have not had a wave of cases that have overwhelmed our healthcare system. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds. Or as we all know now, the time it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And try not to touch your face, especially after touching surfaces. Clean surfaces frequently. If you have to go out for life-sustaining activities, please wear a mask, especially if you're going to come in contact with others. And please comply with the orders yesterday about wearing a mask when you're entering any stores, such as grocery stores or pharmacies, etc. These everyday prevention measures can help slow the spread of this dangerous virus, COVID-19, and give hope to our families and our communities that we will recover together. If you have questions about your health, please contact your health care provider. And if you need mental health resources, because you or someone you know is experiencing a mental health crisis, contact the crisis text line by texting PA to 741-741, or call the statewide support and referral hotline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. Thank you, and now I'm pleased to answer questions.
Thank you, Dr. Levine. From WGAL, the new order yesterday requires workers at life-sustaining businesses and grocery store customers to wear masks. Why now for that order?
Well, so our mitigation efforts have been successful, but they need to continue. We need to do everything we can to prevent the spread of the dangerous virus, COVID-19. And so we want to protect the workers that are in those life-sustaining activities, the really very brave workers that are in grocery stores, in pharmacies, and other types of businesses that really help us every day. And so the best way to protect them is for everyone to wear a mask. Remember, my mask protects you, and your mask protects me. And if everyone is wearing a mask, then more are protected, and we can help prevent the spread of this virus.
From WFMZ, non-contact thermometers are next to impossible to find online or locally. Will the state give any leeway to essential businesses with a COVID case who can prove that they've placed an order for a thermometer?
We really want people to be able to do the temperature checking, and so I think that hopefully it would be possible to get some type of thermometer. I guess if you can't, then reach out and we'll try to help you get a thermometer, but please do so as soon as possible.
From Penn Live, what kind of guidance is the administration providing to food retailers on how to enforce the use of masks for customers? Also, would the state consider giving retailers more time to implement the orders announced yesterday?
So we're not going to extend the time for the implementation of the orders. And so we recommend that if someone comes to a retailer, to a store, a grocery store, and doesn't have a mask, that they be asked to go home and get a mask. I guess if the store has extra masks, they can certainly give one to that customer, and that would be great. But if not, then the person should be asked to go home to get a mask.
From the Philadelphia Inquirer, does the new mandate on masks for life-sustaining businesses apply to public transit like SEPTA? And also the follow-up is, what about taxis, Ubers, and Lyfts? Must drivers wear masks, and must those companies provide them?
So we would prefer if all companies, such as Uber and Lyft, did do that. And I think it would be much better if on public transportation everyone wore a mask. And we are recommending that, but that wasn't specifically part of this order.
As a follow-up, just to restate whether, because manufacturers are having a hard time getting masks, there is the question again as to whether or not you would grant an extension. This is from WPXI-FM. Would you consider exemptions in the order for some manufacturers that prove it is a safety hazard to wear a mask?
I don't know about where it would be a safety hazard to wear a mask. There is actually, for some individuals, because of physical issues who can't wear a mask, then that's already covered in the executive order and they don't have to. But I'm not aware of any business or any manufacturer where wearing a mask at the business would be somehow a hazard. I guess we'd consider that. But there is not going to be an extension of the time with the order for when it needs to be implemented.
From WFMZ, starting Sunday night, will riders of public transportation be required to wear masks?
It would be strongly recommended for riders on public transportation to wear a mask. Again, the more people who are wearing a cloth mask, the more effective it is, but it's not specifically required. But again, you know, these masks are easy to make even at home, and we do have instructions on our website about how you can make a mask. And so we're really recommending that as a public health measure, it'll be safer if everyone who goes outside wears a mask.
From WKOK regarding antibody testing, what is the time frame for the rollout of tests, and how many people will be able to be tested?
Well, so the first antibody test, which was what's called a low throughput test, it only tests do a number of samples in an hour at the laboratory, was last week. The FDA did approve 2 tests last night, and so our lab director is looking at those tests to see which one we might be able to get for our laboratory in Exton, and then hospitals and health systems will be looking at the available tests, as well as commercial laboratories such as LabCorp and Quest, about which antibody test would be best to do. And then we're going to need to work out under what best conditions it is to do that testing. It's really going to be more important from a surveillance, public health point of view than it is going to be for individual people. But I think it will be really important for healthcare workers and maybe in long-term care living facilities.
As another question from WKOK, some universities are starting to cancel fall events and even fall classes. Will we be under a stay-at-home order into this fall?
So we don't know how long we'll be at a stay-at-home order. As Dr. Fauci has said, the virus determines the timetable. We don't determine the timetable. And so those colleges and universities are making their own decisions for their own reasons, but we can't establish any timetable right now.
From the Capital Star, some experts estimate we'll need 750,000 tests weekly nationwide to start reopening. What would Pennsylvania need?
Well, we're looking at that now. We'd like to do much more widespread testing. We have had a recent decrease in terms of the number of tests. We've had great difficulty accessing the reagents and chemicals that were necessary. 2 of the mass testing sites closed in Philadelphia and Montgomery County. But as I announced yesterday, the testing site in Montgomery County is now opening up. Then we're also looking at a testing site in the Northeast, which would be very helpful, and we'll be looking at further testing sites as possible.
From the Philadelphia Inquirer, the Department of Health says there are positive cases of coronavirus in about 300 long-term care facilities. Why won't it identify those facilities?
Well, we're talking about exactly which information we will identify. And you are correct, though. This is our most vulnerable population. And so we're doing everything we can to help nursing homes and to help personal care homes and all long-term care living facilities deal with this dangerous virus, COVID-19. We have daily consultations with many nursing homes, with our staff, as well as with our contractor, ECRI, to do everything we can to protect them.
And then as a follow-up, the Inquirer asked, how many long-term care facilities are there in Pennsylvania?
Well, I know that there are 695 approximately nursing homes, and I believe that there are several thousand personal care homes. I don't have that exact number at my fingertips, but we can look at that information. But there's far more personal care homes than there are nursing homes.
From Public Source, given the infection control problems at nursing homes, can you speak about what specific measures were taken and when by the state to ensure the protection of this vulnerable population?
Well, we have been working with nursing homes from the beginning in all long-term care living facilities. We put out guidance for prevention of the spread of COVID-19 weeks and weeks ago, and there also has been guidance from the Center for Medicare and Medicaid Services for those facilities as well. And then for individual nursing homes and personal care homes that had symptomatic patients, we've been working with them to make sure they get testing, and then on infection control procedures, and then also making sure that they have the personal protective equipment that they need to take care of patients. If there has been an outbreak, then we have done a real deep dive with them in terms of infection control, cohorting of patients, cohorting of staff, and then ECRI, which we hired a week or so more ago, is doing even more infection control consultations. And again, it's absolutely one of the priorities for the Department of Health and the administration and the governor.
From WHYY, is there a plan to order nursing homes to provide a separate unit for COVID patients, or create COVID-only nursing homes? And some other states like Michigan are doing this.
So it's not an order, but we have talked about that cohorting, is that if they have patients with COVID-19, if they are on different units, to actually put them on the same unit. So you have a unit where patients do have COVID-19 with specific staff with PPE to take care of them, and then a separate unit where patients don't have COVID-19 with completely separate staff. So there's no mixing of staff, and we can hopefully isolate the cases there. We haven't talked about creating an only COVID-19 nursing home. That's something possibly that we could think about in the future.
From WFMZ, some businesses trying to get cleaning supplies like sanitizing wipes are being told that warehouse workers have been reduced to meet social distancing policies and that it's slowing down fulfillment of those orders. Would the state consider relaxing some restrictions on warehouses that may be slowing down the supply chain for vital goods?
No, we're not going to relax those guidelines, because then we could more likely to have an outbreak in the warehouse. So we'll all do the best we can with the current challenges in terms of supplies and supply chains to get the necessary supplies and resources that we all need.
From WNEP, epidemiologists have said that previous pandemics, such as SARS, were controlled by herd immunity. A viewer asks if the current stay-at-home situation may be limiting the development of this immunity.
Well, herd immunity means that a significant number of the population have the virus, so it's less likely to spread. SARS was a completely different coronavirus, so it is in that family, but it's not COVID-19. SARS, although actually more virulent, which means that people got even sicker. More people died of SARS, which much less contagious than COVID-19, and so it was much more easily controlled. COVID-19 is a very contagious virus, and maybe 10 or up to 20 times more contagious than the flu. If we had let it spread through the community to get herd immunity, then we wouldn't have 27,000 cases. We'd have 70,000 cases, and we wouldn't have the number of 700 deaths. We'd have 2 or 3 times that. So just letting it spread through the community to develop herd immunity would have been potentially catastrophic for people in the state, and then would have completely overwhelmed our healthcare system.
As a follow-up, WNEP is asking about a field hospital that will soon open at East Stroudsburg University. Viewers ask why the field hospital is there and not in Hazleton, which has a higher number of cases. And when the field hospital opens, will it handle overflow patients from hospitals in New York and New Jersey? There were a lot of discussions with the Pennsylvania Emergency Management Agency as well as federal authorities about the location, and it was strongly felt that that was the best location. And it would see overflow patients, but not from other states. It would potentially see overflow COVID patients from hospitals in the Northeast. Another question from WNEP about viewers asking about the mass testing site that you referenced in the Northeast near Wilkesboro. Who is eligible to be tested, and what steps are necessary to register for a test?
Well, when it's up and running, then people will be able to register online to get a test. And the priorities will be high-risk individuals. So it would be healthcare workers and then seniors with symptoms. There is no plan to do any testing of people who are non-symptomatic. If you are asymptomatic, we're not able to do at this time that type of population-based surveillance testing. We just simply don't have the resources. And really, outside of very small pilots, no one has the resources to do that. We hope to in the future.
From the Citizen's Voice regarding that mass testing site, is the department considering another location in light of the request for reconsideration?
We're not considering any other location for the mass testing site, but we'd like to set up other mass testing sites in the future. But right now we're concentrating on the Montgomery County mass testing site and the new one in the Northeast.
And then will that facility be open to everyone or just residents of certain counties?
It will not be just for certain counties, but we're not really expecting people to drive hours to go to that mass testing site. It will be for patients in the Northeast. And again, it's going to prioritize healthcare workers and seniors with symptoms.
From WNEP, is it possible that medical insurance will be extended by the state to all residents who lost or do not have medical coverage for tests and other medical services rendered because of COVID-19?
The governor is certainly in favor of everybody having insurance, and that's why the governor expanded Medicaid now over 5 years ago. And we have one of the lower uninsured rates in the country. But the federal government has said is that no one will be left in the lurch, so to speak, if they need treatment for COVID testing or treatment for COVID-19 because they're not insured. And so that would be from the federal government that those resources will be provided.
From the Tribune Democrat, we're hearing suggestions that the numbers of deaths is, I believe what they mean to say is underreported because all COVID-19 positive patients who die are included regardless of the cause of death or other factors. I apologize. Let me rephrase that. The Tribune Democrat is saying that they're hearing suggestions that, on one hand, the number of deaths are inflated because of all COVID-19 positive patients who die are included, and then on the other side, that the actual deaths might be higher because there isn't enough testing. Can you elaborate on the situation and the challenges in accurate reporting?
Well, it is a challenge, but right now the deaths that we are reporting are confirmed COVID-19 deaths. These are only patients who had tested positive for COVID-19. We're not reporting any other categories such as probable deaths or things like that. So, but it is a challenge from throughout the state to gather that data, but we're working on different ways to gather it even more efficiently.
And then, as a follow-up, the Tribune Democrat would like to know, today's report includes nursing home employees. Does the number of deaths also include employees who have died?
The number of deaths includes anybody who passed away from COVID-19 as of 12 midnight yesterday. And so all the reports we give are inclusive. So, for instance, in terms of the healthcare workers, that is inclusive of the staff in long-term care living facilities who have tested positive.
From the Scranton Times, understanding that the cutoff for reporting of deaths and cases is midnight, we've detected a sharp disparity in death reporting in Lackawanna County. The county coroner today is reporting 38 deaths as of midnight. You're only reporting 28 deaths as of midnight. Any idea why that would be? He confirmed that all of his deaths lived in the county. I'm
not sure, but we'd be pleased to look into that and contact the coroner and try to make sure that the data is consistent.
From WTAE, if businesses remain closed past April 30th, will the same order to stay in place and not visit family that you don't live with? Is there any guidance on whether that part of the order would be relaxed?
So right now, today, there is no plan to relax that order.
And then as a follow-up, I have several outlets asking about the extension that New York has extended its stay-at-home orders until May 15th. Do you foresee this happening in Pennsylvania?
We're having those discussions with the senior staff in the administration and the governor, and so at the right time, the governor will make announcements related to all of those issues.
From ABC 6, Trump says that he sees easing physical social distancing in certain parts of the country. How do you see restrictions being eased, and when do we start? And as a follow-up, are you concerned that people are not taking the guidelines seriously and you think wearing masks can help lift those restrictions to keep them safe?
Well, we really feel, the governor and I and the administration feel that people will do and are doing the right thing. And the right thing now is we have to continue those prevention and mitigation and stay-at-home orders to prevent the spread of COVID-19 in Pennsylvania and to prevent our healthcare system from being overwhelmed. There are discussions going on within the administration and with other stakeholders about the path forward. How are we going to when the time is correct, work to improve the economy of the state and perhaps relax some of the social distancing, particularly from an economic and business point of view. And when those plans are ready, the governor will make those announcements.
From News Talk 104.1, several thousand people plan to descend upon Harrisburg on Monday in defiance of the stay-at-home order. What would you say to them when 43 counties have less than 100 cases and 31 of those counties have less than 50 cases?
Well, I think that if you come to Harrisburg and you're not practicing social distancing, then you are putting all of yourselves at risk. And so if a gathering like that happens and they're not practicing social distancing and they're not wearing gloves and they're not washing their hands, etc., then they will be more at risk from contracting the dangerous virus COVID-19. We understand that the majority of cases have been in the southeast and the northeast, and we're very pleased that the rest of the state has been less affected by COVID-19. But now is not the time today to relax those social distancing, and that's the recommendation I would make to anyone planning to come and protest.
As a follow-up, News Talk is also saying many of our listeners who own businesses are asking why they must remain closed when the 10-county region where they live, there are 350 cases and a few deaths. Sullivan County has 1 case. What would you say to them? Well,
so we know that the number of cases is underreported. We've talked about the challenges we've had with testing. And at the moment, we're testing symptomatic people. Those who are very, very mildly symptomatic or asymptomatic, we're not able to test at this time. So we know that it's underreported. And so we know that the number of cases in those rural counties is higher than the numbers that we can verify and report. And so there is COVID-19 there. It's just because they're rural and they have less population density, people are somewhat less at risk there. But right now, the time is right to continue to stay home and to continue to practice the prevention activities to prevent COVID-19 from flourishing in those communities.
From the Allentown Morning Call, can you speak to a bill that was approved by the Senate on Thursday that would, if it became law, delegate to counties the decision-making on business openings and closures during this public health crisis?
Well, I'll leave it to the governor to discuss specific bills, but right now is the time from a statewide point of view to be consistent and to practice the social distancing and the mitigation prevention measures that the governor has ordered.
And then as a follow-up, the Morning Call is asking, with lower testing rates, are we by definition going to have fewer documented cases? Are we flattening the curve or flying blind?
So we're looking at many different measures when we talk about flattening the curve. We're looking at the number of cases, the number of positives, the percent of cases that are positive in each area. And we're also looking at something called syndromic surveillance, which is emergency department visits with specific diagnoses of coronavirus or COVID-19, but also influenza-like illness and fever and cough, etc. And they are all going down. And so we're very confident that we have flattened the curve, but it is correct that we need to be able to expand testing. We're having those discussions vigorously over this week, and we're going to work to expand testing as far as we possibly can.
Dr. Levine, Penn Live is asking, how much protection does a mask provide?
A mask provides some protection for someone if someone has COVID-19 and has perhaps mild symptoms or is just developing symptoms from transmitting it. So to repeat, my mask, if I had COVID-19, protects you, and your mask, if you had COVID-19, protects me. But if both people are wearing masks, then that increases the protection. It is by no means 100%, which is really why people should stay home.
From the Capital Star, what steps is PA taking now to establish a contact tracing program so that it's in place once serological testing becomes available? Health officials in Massachusetts have hired thousands of people to trace contacts there. Would Pennsylvania do the same?
Well, we're having those discussions as we speak. So as we contemplate relaxing some of the social distancing in the future, according to when the governor decides, then we would want to be able to have testing available. We would want to be able to do contact tracing, as well as isolation and quarantine of positive patients and their contacts. That would be really important to prevent an outbreak from flaring up. And so we're discussing, as we speak, all of those different measures that we would be able to put into place.
From Lehigh Valley Live, are we reaching the peak as expected? And does this resemble more the best case or worst case scenario?
Well, so it depends what model you look at. If you're looking at the model from the University of Washington, then the peak in terms of healthcare utilization was going to be today. So right now, our healthcare system is very solid, and we're able to take care of patients with COVID-19 as well as other acutely ill patients. That model says that the peak in terms of deaths would be in several days. So we will see which model, if that model is true and things start to go down later. But again, modeling is just modeling, and so we're watching the situation on the ground. But if you also compare where we are compared to FEMA models from 3 weeks ago or more, we have certainly bent that curve, both in terms of the number of patients we have, the number of hospitalizations we have, and the death rate. So I think that the mitigation efforts have been successful, but right now we need to continue them.
Thank you, Secretary. That is all the time that we have. That concludes our briefing for today. Our next briefing will be tomorrow. Thank you.